Hi, it's Carl Lishing again, an independent insurance agent based out of Lakewood, Ohio. Today we're going to do a bit of a deeper dive on original Medicare with a standalone drug plan and a Medicare supplement versus Medicare Advantage and what the pros and cons are to each. Now, product availability for Medicare beneficiaries based county by county. In Cuyahoga County, I'm contracted with, we don't represent every carrier. We are contracted with 10 companies offering 99 products. For a complete list of everything that's available, you can go to medicare.gov or visit your state health insurance office. Now, moving into the Medicare a little bit. Medicare with a supplement versus a Medicare Advantage plan. Let's kind of put these up on the board side by side and talk about Medicare with a supplement versus Medicare Advantage. Now, on this side over here, Medicare with a supplement, from a consumer's perspective and what we pay month in and month out, when we put these two side by side, I kind of use the old saying, pay me now or pay me later. When you have original Medicare with a supplement, you're going to pay more on the upfront, higher premium, to have the lowest out-of-pocket exposure available for medical spending. With a Medicare Advantage, it's kind of the opposite. You can have a premium as low as zero, but you pay copays along the way, and they have a cap on them, a maximum out of pocket. Now, that's going to vary from area to area across the country and from plan to plan. In Cuyahoga County, Northeast Ohio, most of the most competitive Medicare Advantage plans usually keep that maximum out of pocket between $3,000 to $4,500 in the year 2024. Now, that's kind of the money side of it. Now, there's also pros and cons to each side as far as how it operates behind the scenes. With original Medicare and a supplement, all the claims go to Medicare first, the federal government. And the member can go to any doctor or hospital anywhere in the country as long as they take Medicare. So there's no networks. And the federal government as a payer doesn't have a lot of pre-certification and managed care requirements where the doctors and hospitals have to call first and get things pre-approved and set up. That's more common on Medicare Advantage because there's managed care programs involved to better control spending and patient outcomes. So all the claims go to original Medicare first here, and then people get a supplement to fill the gaps. Now, the supplement itself, they have letters on them, letters A through N. Some of them have been discontinued and they don't exist anymore. The ones that people tend to gravitate to are Plan G, that's, I'd say, the most popular, or Plan N. Those are the two most common ones. Now, on a Plan G, all the claims go to Medicare first. If Medicare pays as primary because it's a covered expense, then the supplement fills the gaps. Now, if it's not a covered by expense by original Medicare, the supplement won't cover the gaps either. So it has to be something that's covered by Medicare. Now, Plan G, as in George, it doesn't cover the Medicare Part B deductible, which is $240 this year. So it's fairly small. So anything underneath $240 for outpatient services like doctor's visits, specialists, testing, so on and so forth, the member could get billed for anything under $240. But once they hit that $240 deductible, everything on the other side of that is covered. So that is going to be the most popular. Plan N, it's kind of similar where it doesn't cover that Part B deductible. But then after that, the member's paying the 20% of the doctor's visits, but there's a cap on it of $20 for doctor's visits. Emergency room is capped at $50. And Plan N also doesn't cover what are called Medicare excess charges. Now, in the state of Ohio, Medicare excess charges don't exist. There's not a lot of states that work like this. I believe the number is 8 of them. Now, what a Medicare excess charges is Medicare, original Medicare over here, pays certain amounts for certain procedures. That's called Medicare assignment. In Ohio, the healthcare providers have to accept Medicare assignment as payment in full. They're not allowed to bill more. Now, in other states, in most of them, they can bill what's called an excess charge. If the doctor feels that Medicare assignment amount is not adequate, they can balance bill the member an extra 15% of the Medicare approved amount. So the G plan will cover Medicare excess charges. Plan N does not. Those are the two most popular ones. Now, if you have original Medicare with a supplement, then you got to get your Part D for drugs separate. There's premiums as low as $0 a month. I've seen them as high as 110 in our county. On average, they probably run around 30. On a Plan G for a male, I'd say they probably average around 135 at age 65. For a female, it's usually around 125, give or take a little bit. And this is all on top of the original Medicare Part B premium that people have to pay, which is $174.40 this year. Now, when determining which Medicare Part D plan is going to be the most appropriate, it's good to evaluate the person's medications. There's several different shopping tools. We have some of ours that we use in-house, where we enter the person's medications, and it will pull data from the plans and sort them in different ways. Usually I sort based on total estimated costs and which plan is going to have the lowest total cost. That accounts for the monthly premium that the person is paying, plus the projected drug cost over the course of the year. And it adds them to those two things together to come up with which plan would have the lowest total estimated cost. Now, original Medicare doesn't cover dental and vision. So if somebody wants dental and vision, they have to buy that separate too. They tend to range between $25 and $57 a month, depending on the level of coverage. So we'd say on average around 40. So if you take the Medicare supplement plus a drug plan, depends on where they end up, plus dental and vision, it's not unusual for a 65-year-old, somebody that's new to Medicare, to be around $200 a month, give or take a little bit on that, depending on these variables, on top of the Medicare Part B premium, which is $174.40 for Part B. So that's having original Medicare with a supplement. Any doctor, any hospital, as long as they take Medicare, the supplements fill the gaps, not a lot of managed care. So there's a lot of freedom and flexibility. So this might appeal to people that are willing to pay that higher monthly premium to have the more comprehensive coverage, or would say they're new to Medicare. When you're new to Medicare, a supplement over here, it's what's called open enrollment. That exists for 6 months after the person activates Medicare Part B and the Medicare Part B effective date. They have to be accepted. The insurance companies cannot decline them. Now, if somebody goes with a Medicare Advantage plan and then several years goes by and then they want to get a supplement, it is subject to underwriting approval in the state of Ohio. And insurance companies can do one of three things. They can issue it at the standard rates that they publish. They can issue it at an increased premium that might make the member wonder if they want to pay that much, or they can straight out decline it. So let's talk a little bit about Medicare Advantage. Now, the way Medicare Advantage works, and it's often also referred to as Part C, because what a lot of them will do is take Medicare Part A, Part B, plus D for drugs, put them in the blender, and C comes out of that somehow or another. These plans can come with drug coverage, which is called an MAPD, Medicare Advantage Prescription Drug Plan, or Medicare Advantage only, MA only. Most people are probably going to benefit from having drug coverage. The plans that don't have the drug coverage, the MA only, that could be maybe appeal to somebody that has been without Medicare Part D for some period of time. And if they join a Medicare plan that has drug coverage, then they're going to have the Medicare Part B late enrollment penalty to pay. It's roughly around 35 cents a month for every month that the person went without it, that they should have had it. So the government will calculate how many months that they have on file where the person didn't have Medicare Part D and charge them that Part D late enrollment penalty. It can add up over time. So it's good to have Medicare Part D for a couple reasons: to avoid the penalty. But I think personally, more importantly, somebody might think they don't need it now because they don't take any expensive medications. but health can change in a hurry. And if somebody's on a medication that's 500 plus a month, they're going to wish they had drug coverage. And if they don't have it, they have to wait for the annual enrollment period to add it, which is October 15th to December 7th. And then that drug coverage wouldn't start till January of the following year. And then the penalties apply. So it's best for most people to have Medicare Part D. For those that don't want it, there's the MA onlys. Maybe they could possibly have coverage through another source for prescriptions like VA, and they don't see the need to have it through their Medicare plan. But most of the time, people should have Medicare Part D. Now, with an Advantage plan, the federal government has contracted with private healthcare companies, and they send them the money to run it. The thought process behind it is that the insurance companies are going to compete for business. They're going to manage the spending better and the patient outcomes better. And the dollars that Medicare is spending towards covering people, it's more cost effective with Medicare Advantage. That's the thought process behind it. Now, the insurance companies use their managed care contracts, like of networks of doctors and hospitals. That's part of the way they help control costs and negotiate pricing. And they also have managed care programs. Now, managed care has some benefit and there could be some disadvantages. But let's talk through that a little bit. So some of the advantages of managed care is they tend to be a little bit more proactive on early disease detection, chronic disease management, encouraging people to go in for routine physical exams and staying on top of things, catching it early, educating members on certain medical conditions and things that they can do to better control the medical condition so the person has a better quality of life. But at the same time that's happening, it helps to reduce claims expenses. So that exists with managed care. Some of the downsides to managed care is the healthcare providers, if they're recommending something to be done, they might need to coordinate with the plan and get prior authorization done. And then the health plan is going to be involved in determining if it's medically necessary and appropriate to the course of treatment. Generally, that is not a problem. I don't have too many cases where it becomes one. If it's something that's declined, there is an appeal process for each company that people can work through. Also on managed care, they might be looking at skilled nursing or rehab and therapy, and how much does the person actually need as to how many days they're going to authorize or how many therapy visits. So their Medicare and Medicare Advantage plans pay to get people better, but they don't pay for what's called custodial care when they're not getting better, but they need help with activities of daily living. So if they're in a rehab facility and they need to stay there longer to get better, they'll authorize more days. But if they've kind of plateaued and they're not getting better, they're not going to pay for the skilled nursing facility to become custodial care provider. Whereas original Medicare over here with the supplement covers up to 100 days, and there's not a whole lot of managed care going on to see if they need to be in there longer or not. So a little bit of pros and cons. Now, from a financial perspective, Medicare Advantage plans, they can have premiums as low as zero, or there's low premiums on these, 0 to low premiums. Most of the competitive plans in Northeast Ohio tend not to have deductibles. Some do, most don't. But the member pays as they go. So people sometimes ask, how can it be 0? It's 0 because it's getting federal funding. And the amount of money that they're getting is enough to run it without having to charge you more. Now, the member over here on this side is going to pay co-pays along the way or co-insurance. Co-pays are a fixed dollar amount. Co-insurance is a percentage of the bill, like 80-20 or 50-50 or 70-30. And then what happens is these co-pays and co-insurance will accumulate towards what's called a maximum out of pocket. So there's that high-end limit. Now, what goes towards the maximum out of pocket, it's stuff that's covered by original Medicare Parts A and B. So prescription drug costs don't go towards that, neither do dental or vision. And in Northeast Ohio, as I mentioned before, most of these plans keep that maximum out of pocket between $3,000 to $4,500 in plan year 2024. These plans are allowed to have additional benefits like dental, vision, over-the-counter allowances. Some of them will have food card allowances. In many cases, the food card allowance might have to have a qualifying health condition in order to get it. blood pressure, cholesterol, diabetes, where if people eat healthy foods, it'll help better control the chronic condition that they might have. Not all of them have the food card allowances. Some do, some don't. Some of these plans even will tout Part B premium rebates, where the plan will put money back into the Medicare beneficiary's Social Security check to help offset the Medicare Part B premium of $174.40. My thought on that is it's probably not right for most, but for some people it might be. Because if the money's going back into the Social Security check, it's not going into the benefits. So usually the copays, the maximum out of pocket, the benefits in the plan are not as robust because the money's going into the Social Security check. So for people that might find that attractive, which if they're veterans and they're going to the VA for all their health care and they're just looking for something to back it up in the event of an emergency, or if they want to go outside the VA for another medical condition, but they don't really intend on using the plan a lot, but they'd rather have the money back into the Social Security check, that can be a good option. Or for the real healthy person that just would rather have the money in the Social Security check because they don't plan on using the Medicare plan at all, that could be another case. But for most people, I usually try to stay away from the give back plans for a bulk of people that are really getting this for their health benefits and not money back into their Social Security check. So if there's questions on that, I'd be happy to address them on a one-on-one basis. That's kind of the high-level overview of original Medicare with supplements, Medicare Advantage plans, some of the pros and cons. I know people like to have opinions on this stuff. I've heard some people say, I heard from my friend, don't get a Medicare Advantage plan. And then I've had other people say, why get a Medicare supplement when you can get an Advantage plan at no cost and you just pay as you go? It's going to be a case-by-case, person-by-person, personal decision that each person needs to make for their own. And I'll help that person understand these trade-offs, the pros and the cons. One other thing to add in there, if somebody goes on to Medicare for the first time when they're turning 65 and they get a Medicare Advantage plan, there's a 12-month test drive to check this thing out and see if they like it. And then in that first 12 months, they can still go get a Medicare supplement, no questions asked. Now, if they start on this side, Medicare and a supplement, and they go to an Advantage plan in the future, there's a 12-month test drive. If they decide they don't want it, they can go back to their supplement in that first 12 months. After that, it is subject to underwriting, as I mentioned before. So it is easier to start here with Medicare and a supplement and go to the Advantage than the other way around. So if somebody's kind of on the bubble and they're not sure, I usually recommend start over here with Medicare and a supplement. You can always go this way, and then you got that 12-month test drive, and then you can go back here. Over time, most people will probably end up ahead financially with Medicare Advantage plans. If you're not paying anything and you start thinking about how much money you're saving every month, and over the course of a year, over the course of 2 years, 3 years, 5 years, 10 years, 15, 20, 25, because these are going to go up. Medicare supplements do go up over time based on age and inflation. So over the course of the balance of a normal life expectancy, it can add up to be tens of thousands of dollars. So it comes down to from a financial perspective, pay me now or pay me later. Pay me now on this side, pay me later over here. They're both good, but they work differently. And then you got those trade-offs on the managed care. This side doesn't have a whole lot. This side has a little bit more. But in Northeast Ohio, the provider networks on these plans are pretty robust. It's not like there's not a lot of choice on where you can go. But when choosing a Medicare Advantage plan, the driving factors, from my opinion, are going to start with prescriptions and the provider network, making sure that the person's medications are covered, because each person has unique medications. Each plan's going to have a different way they cover them. And what they're going to cost, and then that the provider network works. Some of them are local networks, some of them are national. So we need to verify what the person's lifestyle is like and what doctors and hospitals they want to have on a plan. Those are the main variables. And then after that, then we start getting into the co-pays, the benefits, and things of that nature, the extra things, to see if there's anything within the from one plan to another that will make one a better fit for a member compared to a competing company or a competing product. So if you'd like to talk more, call the number on the screen, or you can use the icon on the screen to book an appointment. Again, thanks for your time.